Ginger, with its distinct aroma and pungent taste, has been a staple in traditional medicine for centuries. From soothing nausea to easing muscle pain, its therapeutic benefits are widely recognized. This knobby rhizome, originating from Southeast Asia, has seamlessly integrated into culinary traditions and natural remedies across the globe. Think of ginger's warming sensation. That's its active compound, gingerol, working its magic. Gingerol is known to possess potent anti-inflammatory and antioxidant properties, making ginger a sought-after natural remedy for various ailments. From a comforting cup of ginger tea on a chilly evening to the subtle spice it lends to stir-fries, ginger's versatility is undeniable. But like any potent substance, even one derived from nature, ginger isn't a one-size-fits-all remedy. While generally safe for consumption, there are instances where ginger may interact with pre-existing health conditions or medications. Understanding these potential risks is crucial to enjoying ginger's benefits responsibly and safely. While ginger is often celebrated for its health benefits, it's crucial to acknowledge that its potent properties can pose risks to individuals with certain health conditions. Just as a doctor carefully considers a patient's medical history before prescribing medication, we must approach natural remedies with the same level of caution and awareness. This section delves into specific health conditions where ginger consumption should be approached with caution, backed by scientific evidence. By understanding these potential risks, we can empower individuals to make informed decisions about incorporating ginger into their diets or wellness routines. Remember, knowledge is key when it comes to harnessing the power of natural remedies safely and effectively. Remember, this information is for educational purposes and should not substitute professional medical advice. Always consult your healthcare provider if you have concerns about incorporating ginger into your diet, especially if you have pre-existing health conditions or are taking medications. One area of caution with ginger involves individuals taking blood-thinning medications. Ginger, in some cases, can amplify the effects of these medications, potentially leading to complications. Imagine a person on blood thinners enjoying a large ginger stir-fry. This combination could increase their risk of excessive bleeding. Why does this happen? Ginger contains compounds that can inhibit platelet aggregation, meaning it can make your blood less likely to clot. While this can be beneficial in moderation for someone already on blood thinners, it can lead to a dangerous situation. Therefore, it's crucial to consult your doctor before incorporating ginger into your diet if you're on blood thinners. They can advise you on safe consumption levels or suggest alternative remedies that won't interfere with your medication. Remember, your health is paramount, and erring on the side of caution is always the best approach. Another area where caution is advised is for individuals with gallstones. Ginger, known for its digestive properties, can sometimes exacerbate gallbladder issues. Imagine a scenario where someone with gallstones consumes a large amount of ginger tea. This could potentially trigger a gallbladder attack, causing significant discomfort and pain. This is because ginger stimulates the production of bile, which can be problematic for those with gallstones. The increased bile flow can put pressure on the gallbladder, leading to pain and complications. While ginger can be beneficial for digestion in many cases, it's crucial to be mindful of its potential impact on pre-existing gallbladder conditions. If you have a history of gallstones, discussing ginger consumption with your doctor is essential to ensure you're not putting your health at risk. Ginger's potential impact on blood sugar levels is another area of consideration, particularly for individuals with diabetes. While ginger is often touted for its potential to improve insulin sensitivity, its interaction with diabetes medications can be complex. Imagine a scenario where a person with diabetes significantly increases their ginger intake without adjusting their medication dosage. This could potentially lead to a dangerous drop in blood sugar levels, a situation that needs to be carefully managed. While ginger might offer benefits for managing blood sugar, it's crucial to do so under the guidance of a healthcare professional. They can help you determine safe consumption levels and monitor your blood sugar to ensure ginger is working in harmony with your diabetes management plan, not against it. Remember, when it comes to managing diabetes, a balanced approach is always key. During pregnancy, many women turn to ginger to alleviate morning sickness, a common ailment in those 9 months. While ginger is generally considered safe for pregnant women in moderate amounts, it's crucial to exercise caution. Imagine a scenario where a pregnant woman consumes large quantities of ginger in an attempt to combat severe morning sickness. While her intentions are good, this could potentially increase the risk of complications. It's crucial to remember that what we consume during pregnancy impacts not just ourselves, but also the developing fetus. Therefore, if you're pregnant and considering using ginger for morning sickness or any other reason, consult your doctor first. They can advise you on safe consumption levels and ensure it won't interfere with your pregnancy or the baby's development. In conclusion, while ginger boasts a plethora of health benefits, it's not a universal panacea. Understanding its potential interactions with certain health conditions is crucial for safe and effective use. Like any potent substance, natural or pharmaceutical, paying attention to your body's response is key. If you experience any adverse effects after consuming ginger, discontinue use and consult your healthcare provider. Remember, your health is a journey, and being informed empowers you to make the best choices for your well-being. By approaching ginger with both enthusiasm for its benefits and respect for its potency, we can harness its therapeutic potential safely and effectively. Remember, knowledge is power when it comes to making informed decisions about your health.